everybody, thank you for tuning into this video today. My name is Lindsay DiCarlo and I'm the PharmD Recruitment and Event Coordinator at the University of Wisconsin Doctor of Pharmacy program. Today I'll be talking with Dr. Denise Pigarelli, Associate Professor in the Pharmacy Practice Division here in the School of Pharmacy, about her responsibilities working as a pharmacist, a researcher, and a faculty member. Thank you so much for taking our coffee break with me today, Denise.
Happy to be here, Lindsay. Thanks for inviting me.
Of course, love to have you. So to kick us off, can you start by telling us a bit about your clinical work as a practicing pharmacist?
Sure. My practice is in diabetes clinic at the Madison VA. Given my training and credentialing, my title is clinical pharmacy practitioner, and I work under the scope of practice document that's approved by the chief of the pharmacy service at the VA, the chief of the diabetes or endocrine service, the chief of staff, and the hospital or facility director. So I need to make sure I've got all my P's and Q's because, you know, they all have to say it's okay for me to do what I do. I have my own list of veterans to whom I provide ongoing care, so what we call like a panel. And that's either by in-person appointments or virtually by video or telephone. My scope of practice allows me to create and document therapeutic plans right in the medical record, order and interpret lab tests, perform physical exam that's consistent, you know, with my area of diabetes. I don't go outside that, of course. I order and sometimes administer injectable medications as needed in clinic within the scope of practice. I order consults, and I am allowed to prescribe, adjust, and discontinue medications.
Wow, that's a lot. That is a lot. So in addition to your clinical labs, do you teach in the pharmacy program? And if you do, then can you share a little bit about your courses you teach and how they benefit students' preparation for entering the workforce?
Yes, I teach actually both undergraduate and pharmacy students, which is a little different than a lot of the faculty at the school. Regarding the undergrad students, I teach a course called Consumer Self-Care and OTC Drugs, which is an elective course that can be taken as early as the very first semester of college through the very last semester of the senior year. It's actually also a component of the Pharmacy and You first year interest group called FIG, you know, first year interest group. But upperclassmen take the course too. And in fact, it's even an approved elective course for the campus Global Health Certificate program. Yeah, cool. I also teach 2 seminar courses for the first year undergraduate students. And then flipping over like to the PharmD program, I mostly teach in the 3rd and the 4th years of our professional program, though I have some teaching in the 1st year as well. My main areas that I teach for the 3rd year students are the required diabetes pharmacotherapy lectures and discussions and lab. And I also coordinate and teach in the pharmacy non-prescriptions course. Both of these courses are in the fall semester. And then if we change over to the spring semester, I teach an advanced diabetes management elective course for 3rd year students. Then moving ahead to the 4th year, I co-coordinate the advanced pharmacy practice course, which includes like almost all of the elective rotations. They're all mostly under one course number, so I do that. And thinking about like the impact on students, the undergrad course, of course, helps students become more educated consumers. That's why I started the course in the first place. But it also prepares students for what courses in pharmacy school will be like if they're thinking about that as a potential course for them or pathway for them from a rigor standpoint. It's a 300 level course. Additionally, I've learned from a student who recently took this OTC course for undergrads that it prepared them really well to pass the pharmacy technician certification board exam too. I was thrilled. I wasn't even planning for that. She said, oh, I did really well on it. So the diabetes teaching that I do in the 3rd year supports students in the workforce, given the epidemic of diabetes in the United States and also around the world. Maybe you could call it a pandemic from that standpoint. The non-prescription course for pharmacy students helps them help customers or patients both in their 3rd year when they do their experiential rotations and in their 4th year when they do their full-time rotations. And of course, gets them ready for licensure exam and their future career. And I find that this is helpful whether they provide direct patient care or even indirectly, because you have to know this information in order to know a lot of things to practice related to prescriptions or in general about patient care. The elective advanced practice courses in the 4th year allow students to explore areas of pharmacy practice to help them determine what they want to be interested in doing potentially once they graduate.
So I'm going to touch back really quick, Denise, about for the prospective students. So I think you did a good job explaining that if a prospective student here at UW-Madison is interested in pharmacy, taking that course that you could take, the consumer self-care and OTC drugs course that they could take, would be a really great way to explore this profession. In addition to other activities that I could talk with them about, but that's a really great path. So that's a good suggestion.
There's a lot of students who take this course. It's not just students who think they want to be pharmacists, but there's also students who are considering nursing, physical therapy, even some medicine, students who are thinking med school. It just gives them a taste, which I think is good.
That's great. So we're going to pivot a little bit. So in addition to your clinical lab and your teaching, you also engage in research. So can you explain a little bit more now about that? And then if students, so I get a lot of questions from prospective students about, hey, you're a research one institution, like, am I required to do research to get into pharmacy school? Or I didn't have time to get into research when I was preparing for pharmacy school. Are there opportunities to get involved with research once I'm in pharmacy school? So I get those types of questions. So if you could touch a little bit about that.
Maybe I'll address that first. Okay. I don't think not having research in your background is a detriment to coming to pharmacy school at all. Some people have those opportunities or seek them out and some don't. It doesn't really, to me as a teacher, that doesn't make any difference whatsoever. But there are so many opportunities within the School of Pharmacy to get involved in that if it's something that you think you might want, and not just lab research. You could certainly get involved with that if you're interested. But students also can do independent study projects in, let's say, clinical settings, where we're doing clinical studies. I've been working with a student for 3 years now on a study that we've been doing in my VA setting. Or I do educational research projects, and so do a lot of other faculty. And we involve students with that too. So it really just depends on what, the pharmacy student would like to do. The key, though, is to talk about opportunities to faculty. So, approach them, send them an email, talk to them maybe before or after class. So basically seek them out. In addition, some faculty also have really nice descriptions on their faculty web pages so that people can learn a bit more about that. The important thing, though, is to make those contacts because they don't necessarily come to you. Individuals need to think what works best for them and what's of interest, and then go and make those approaches.
Okay, great. So a follow-up about that, if someone's interested in research but doesn't know exactly the type of area they want to go into, would that be an appropriate conversation to have with a faculty member of, I know I want to do something with research, or just, would you be even willing to talk with me about opportunities available here at the school?
Absolutely, yeah. I sometimes have those conversations with students because they're not sure really where they want to start. And so we do like a student office hours meeting and we get to know each other a little bit better. I will admit that probably 80 to 90% of the time, what we eventually discover isn't something that would work with me in particular, but that doesn't matter. I can connect them and make suggestions with other people. So if something doesn't sort of hit you from web pages or from hearing someone talk in class and you're like, ooh, that sounds interesting. I think you can pretty much just seek out, a faculty member that you would feel comfortable with and ask them if you could talk, and they could provide some guidance to you.
Awesome. Is there anything you want to expand about the research that you currently do?
I don't. So a lot of what I do each week is classroom and administrative kinds of things, but I do some research as well. Most of us do. I participate in research within my diabetes clinic. So as I mentioned, I've been working with a student in a study in my clinic, and that was related to patient medication adherence. And I collaborated with Dr. Olayinka Shingbola from the Social Administrative Sciences group, which is what I love. Collaboration's fun, and collaborating with people that I don't normally get to work with is super fun as well. And we've had a really great team for the last 3 years. But I also serve as a research consultant with another actually social administrative person related to their research about OTC use in older adults. I also participate in some educational research about teaching methods and student learning outcomes. That's really important to me because I do so much teaching. And as a result of all of that, we all collaborate together and give poster presentations at professional meetings. We publish professional articles about the work we do. So it's a full experience. It's not just having someone do a survey and you're done. There's a lot involved, and there's a lot of ways students can be involved with many aspects of those processes.
Oh, neat. Thanks. Thanks for explaining all that. I appreciate that. So because this is a short video, we're going to wrap up with our last question. And I wanted to ask if there's anything else you'd like to share about how our PharmD program prepares students for their future in pharmacy.
I think there's a lot of ways to answer this. And I'm going to take the aspect that because our program is part of such a large university, we can offer professional electives in different schools or departments around campus, which makes so many different learning, avenues possible. We don't restrict students to just the elective courses in the School of Pharmacy. And if you're interested in seeing what those might be, if you go to the For Students page of our website, there you can click on the list of non-School of Pharmacy electives that's posted there to kind of give yourself a flavor for what that might be. Some of our courses are even in the School of Human Ecology and the Business School. I am going to sound like I'm advertising, but I really believe this with my whole heart, that our school prepares students well for their future. I think very well. If someone's thinking about applying to our school, I really encourage them to look at like the statistics and the outcomes of recent graduates that we post on our website, because I think that helps you get a good flavor for, kind of what happens to people when they're done with their education. UW Madison School of Pharmacy graduates are really well prepared and have a very strong work ethic. And that reputation isn't just like in the state of Wisconsin, that's kind of known around the country. And this actually happened to me when I graduated with my PharmD in 93. Then I finished my residency in 94 and I moved to the state of Arizona. And when I interviewed there and started my position and started meeting other pharmacists, and they learned that I was a UW Madison graduate, there was like this, they had like this different regard for me, not in a bad way, but in a good way, because they knew I had a really solid background and training and good experiences behind me. And when I talk to people nationally now, that tradition continues. That's not just something that happened back in the 90s. So I'm really proud that our school prepares our students that way.
And we have alumni all over the country. I've heard from our alumni director saying that if you go to different parts of the country in any pharmacy, not any, but lots of pharmacies, you'll have an alumni from our program that have gone through our program, typically working or had worked there at some point. So I think that's kind of a statistics, because we have a very strong alumni network throughout the country, which is pretty neat. So, well, thank you so much for your information. Thanks for talking very briefly about your background, your research, your clinical lab, and your teaching, and all the different teaching, the way that you teach undergrads and our graduate students. So I think what you're doing is important work at our school and in the community and diabetes management. So thank you so much for having a very brief coffee break with me, and we love chatting with you. Thank you. Take care, everybody.
Bye.